Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम DSSB नर्सिंग ऑफिसर एग्जाम द 28 ऑफ अगस्त 2019 शिफ्ट फर्स्ट का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर पिछले वीडियोस नहीं देखा है तो प्लेलिस्ट में जाकर देख सकते हैं और वीडियोस के डिस्क्रिप्शन में भी लिंक प्रोवाइड करवा दूंगा। अगर व्हाट्सएप में वीडियोस का लिंक चाहिए तो पर्सनली व्हाट्सएप मी, माय व्हाट्सएप नंबर इन डिस्क्रिप्शन बॉक्स। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। 51. What is the common pathophysiological mechanism of acute pancreatitis? A. Overproduction of enzymes. B. Malabsorption of enzymes. C. Autodigestion of pancreas. D. Formation of neo. Correct answer C. Autodigestion of pancreas. 52. Which vaccine is not administered to an HIV-positive child? A. Hepatitis B. B. DPT. C. OPV. D. MMR. Correct answer C. OPV. 53. When a person changes from one position to another position of equal status, it is called A. Downward social mobility. B. Upward social mobility. C. Vertical mobility. D. Horizontal mobility. Correct answer D. Horizontal mobility. 51. Identify the correct statement with regard to post-necrotic cirrhosis. A. It is associated with chronic biliary obstruction. B. T is the result of complication of viral toxic hepatitis. C. It is associated with alcohol abuse. D. It results from copulmonale pericarditis. Correct answer B. It is the result of complication of viral toxic hepatitis. 55. Which among the following is not a major manifestation of rheumatic fever? A. Carditis. B. Subcutaneous nodules. C. Chorea. D. Arthralgia. Correct answer D. Arthralgia. 56. The client is no longer interested in going out and meeting friends. This is an example of which behavior? A. Perseveration. B. Avolition. C. Affective flattening. D. Allergia. Correct answer B. Avolition. 57. What is the term coined for circumscribed fear of a discrete object or situation? A. Ailurophobia. B. Specific phobia. C. Agoraphobia. D. Claustrophobia. Correct answer B. Specific phobia. 58. Hardness of water can be removed by which of the following chemical reagents? A. Magnesium carbonate. B. Sodium carbonate. C. Copper sulfate. D. Sulfate dioxide. Correct answer B. Sodium carbonate. 59. The number of deaths due to a particular cause per 100 by 1000 total deaths is known as A. Age-specific death rate. B. Proportional mortality rate. C. Case fatality rate. D. Crude death rate. Correct answer B. Proportional mortality rate. SART. The continuous scrutiny for the factors that cause occurrence or distribution of disease is known as A. Monitoring. B. Eradication. C. Surveillance. D. Screening. Correct answer C. Surveillance. 61. In which year was RNTCP launched? A. 1997. B. 2002. C. 2000. D. 2006. Correct answer A. 1997. 62. Pea soup diarrhea is a feature of A. Typhoid. B. Rotavirus diarrhea. C. Gastritis. D. Cholera. Correct answer A. Typhoid. 63. Which committee is also known as Committee on Integration of Health Services? A. Chadha Committee. B. Kartar Singh Committee. C. Mukherjee Committee. D. Jangalwala Committee. Correct answer D. Jangalwala Committee. 64. What is the main action expected of tricyclic antidepressants? A. Blocking presynaptic receptors of catecholamine. B. Blocking dopamine receptors. C. Blocking GABA receptors. D. Blocking the receptors of norepinephrine. Correct answer D. Blocking the receptors of norepinephrine. 65. Which of the following tools is commonly used to test a person's intellectual function? A. Rorschach blot test. B. Child behavioral checklist. C. Wechsler scale. D. Kate scale. Correct answer C. Wechsler scale. 66. Early diagnosis and prompt treatment is encouraged at which level of prevention? A. Tertiary. B. Primary. C. Secondary. D. Primordial. Correct answer C. Secondary. 67. Which of the following intervention focuses on giving chemoprophylaxis for cholera? A. Prevention of disease. B. Early intervention. C. Specific protection. D. Health promotion. Correct answer C. Specific protection. 68. Which of the following is a way to acquire passive immunity? A. Vaccination. B. Exposure to subclinical infection. C. Exposure to disease. D. Antibody transfusion. Correct answer D. Antibody transfusion. 69. Sudden outbreak of any disease in a community than the expected normal cases of previous year is called A. Endemic. B. Epidemic. C. Sporadic. D. Pandemic. Correct answer B. Epidemic. 70. When a client says, I can't focus, my mind keeps wandering, then the nurse replies saying, you are having difficulty concentrating. This is the example of which communication technique? A. Summarizing. B. Paraphrasing. C. Focusing. D. Confronting. Correct answer B. Paraphrasing. 71. Which of the following vaccines is contraindicated in symptomatic HIV infection whose CD4 count is less than 400 cells? A. DPT. B. BCG. C. Yellow fever. D. Tetanus toxoid. Correct answer B. BCG. 72. Which of the following would be a priority nursing intervention for a patient who has suicidal behavior? A. Avoid bringing up the subject of suicide. B. Ask the patient whether she has a thought of or has plan of committing suicide. C. Actively involve patient in the unit activities. D. Explain consequences of suicidal attempts. Correct answer B. Ask the patient whether she has a thought of or has plan of committing suicide. 73. Oral contraceptive pill contains A. Only estrogen. B. Corticosteroids. C. Only progesterone. D. Both progesterone and estrogen. Estrogen. Correct answer D. Both progesterone and estrogen. 74. The induration of skin between 6 and 9 mm after tuberculin test indicates A. Doubtful for tuberculosis. B. No risk for tuberculosis. C. Contact with active tuberculosis patients. D. Tuberculosis positive. Positive. Correct answer A. Doubtful for tuberculosis. 75. What is the term used to describe a feeding disorder characterized by eating non-nutritious substances such as soil, paint, etc.? A. Anorexia nervosa. B. Bulimia nervosa. C. Binge eating. D. Pica. Pica. Correct answer D. Pica. कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज।